Hello. Hello.
Yes, sir.
Yes, okay. I'm thinking I'm not on mute now. I mute my very happy good morning to everyone. My dear student, I think everybody is in the link. So I can start my screen share now. Sorry. Yes, do you see my presentation? Hello? Hello?
Sir, we can see the presentation, sir.
Yes, you see my presentation now?
No, sir.
Okay, thank you. Yes. Today I lectured on adenoids. Adenoids is one of the tonsil. It's parts of the Walden's rings. I took the lecture yesterday about tonsil. Then another is important adenoids. Adenoids is a enlarged nasopharyngeal tonsil. When the nasopharyngeal tonsil is enlarged, then it is called adenoids. So it is most important for you student and for the ENT doctors and everyone. So we should know about the adenoids. Now I go second slide, which one is which was in you see one video about the one adenoid child, which is
Sir,
yes.
Sir, আমরা slide দেখতে পাচ্ছি না স্যার।
ও slide দেখতে পাচ্ছ না? ও sorry. Bye. No. You no. Okay. I go to my okay. Share screen that I share. Hello. Yes, you, my dear students, you see?
জি স্যার, দেখতে পাচ্ছি
Yes.
স্যার।
Okay, thank you very much, thank you very much. Yes, okay. I go one video of children which sufferings from adenoids. This is my video. I see, you think, you see what happened on this is a one adenoid suffering from adenoids. Is a mouth breathing, as she's mouth breathing, you see, and there is a indrawing of chest, abdomen, and also the supraclavicular region, intercostal region. I think you understand what happened about these children, which is collected from the patients at parents. So I go next slide. Introduction. What is adenoids? It is a collection of lymphoid tissue found in the mucous membrane of nasopharynx. Mucous membrane of nasopharynx. It lies between the roof and upper part of posterior of nasopharynx when the nasopharyngeal tonsil is enlarged. It is referred to as the adenoids. So it is the what is the placement of adenoids in the nasopharynx? Roof, between the roof and upper part of the posterior nasopharynx. It is after how it obstructs the nose, because it just lies behind the corner of posterior nares. It is single midline structure. The deep surface has no capsule. Complete enucleation by dissection is therefore not possible. The deep surface, which is attached in the posterior wall of nasopharynx, it has no capsule. So without capsule, any thing cannot, surgery or complete enucleation or surgery is not possible. Like prostate, it is like prostate. So there is a dissection method. We can just some small portion is retained. This is not complicated for the patient. Hypertrophy of the nasopharyngeal tonsil commonly occurs between 3 to 7 years age. So patient attendant come to you at the time when patient suffering from adenoids. So it is 3 and 7 years. There is so many patients come to us before 3 years, but we cannot advise them to come 3 years. And between the 3 and 7 years, there is a question when it is enlarged. Enlarged and 3 to 7 years. Hypertrophy is commonly occurs in 3 to 7 years. Atrophy usually begins after 10 years of age and completing by 20 years. So 3 to 7 years, it is the most important for the children. Why? Because the patient developed everything about it, the patient's intelligence, patient's is developed this 3 to 7 years. And if this time hampered anything, then the development of the children is not incomplete. So second slide, what going, this is, yes. Okay, this is one of the questions. What is the Walder's ring? You see the picture. This is the pharyngeal tonsil adenoid. At the side of the pharyngeal tonsil, there is a tubal tonsil. Tubal. What tube? Eustachian tube. This is the nasopharyngeal end of the Eustachian tube. So you should know tubal tonsil by tube, Eustachian tube. Then go to the palatine tonsil. This is most important tonsil, which I discussed before lecture. This is two in part, and there is a lingual tonsil. Lingual tonsil is important. So many patients come to you that there is after tonsillectomy, the lingual tonsil is sometimes enlarged. So you are facing the problem, or surgeon is facing the problem. Sometimes there is a symptoms, producing symptoms. So we have to treat them by psychologically that it is not important. The palatine tonsil or adenoid pharyngeal tonsil, this too is important. So you, when there is a viva question or there is a written question, if you marked by this one and marked through this picture, then you will get the full number. Now, this is the picture of one children, how she's lying down. Supinational pronation, she's supine position and open mouth. She's open mouth. You see the video clearly that that is surgical importance. What is the surgical importance of adenoid? It is a part of Walden's lymphoid tissue. Other are tubal tonsil, lingual tonsil, and palatine tonsil. I said, when enlarged or hypertrophied, it can uncross the Eustachian tube opening on the lateral wall. You see that there is a tubal tonsil, Eustachian tube by the side of the nasopharynx. There is an opening in the nasopharynx, and another is in the middle layer. Another opening is middle pharyngeal. One in the nasopharyngeal opening and another is in oral opening. It is in middle layer and causes non-suppurative otitis media OME, otitis media effusion. What it causes? It's caused the conductive deafness of the children. Conductive deafness of the children. Mothers or parents come to you or come to us, ENT surgeon, that they said that when we see the TV, then my child is increase the sound, and the normal sound he or she cannot hear. He or she cannot hear. So another thing is the parents told us that when we call him or her from behind, she or he cannot respond. And third was is by teachers complaint. Teachers complained that your children is not here at all, or is not interested in class. So he or she cannot memorize at all. And it may obstruct the guana and compelling the child to mouth breathing. Obligate mouth breathing, that is compelling. We must. There is a two airway. By born, the children is take their respiration through nose. If nose is blocked, nasal, so there is a mouth breathing and open mouth. Importance characteristics. What is the important characteristic? So when you are in Viva board, there is a question: what is the importance characteristics of adenoids and difference between other tonsil or lymph node? So you can answer easily. This is subepithelial position. Number one, no afferent lymph node channels, only efferent. No afferent. Then to the center or away from the center. One is away from the center and the from the not from the cell. Unlike palatal tonsil, adenoids have no crypts or no capsule. There is no crypts or no capsule. Location, upper part of the respiratory and alimentary tract. Characteristics, growth curve. What is characteristic growth curve? Increase in size early years. When the patient, when the patient is early years, then decrease in adulthood. Increase in children. When the patient is children or infant, then it is increase, but decrease in adulthood. And undergo physiological involution in old age. In old age, it regresses. Almost regresses. And there is a covering epithelium is of three types. Because it is junction of the upper part of the respiratory and alimentary tract. So there is a three types of epithelium covering ciliated, pseudostratified columnar, stratified squamous, and transitional. Three types. Important. This ciliated, pseudostratified columnar, stratified squamous, and transitional. Well-testing previously, I say what is the physiology of the well-testing? A ring composed of malt at the beginning of food and air passages. A ring composed of malt at beginning and produces B and T lymphocyte. Produces B and T lymphocyte in B and lymphocyte local defense, because it is in between in the beginning of the respiratory and alimentary tract. So it make local defense from the any virus or any dust materials or pathological bacteria. The first defense take first defensive mechanism. So it is a mucosa associated lymphoid tissue. Mucosa associated lymphoid tissue. Ring. Oldest ring is mucosa associated lymphoid tissue. That means malt. Also produces lymphocyte to send to other lymph nodes. Also produce lymphocyte to send to other lymph nodes. They signal. They produce send signal to the other lymphocytes to produce produce lymphocyte to other lymph nodes. So you know the lymphocytes are the defensive mechanism of our body, B and T lymphocyte. So when you take food and air, they are in the maximum all-string in the all the all-string in the beginning of the food and air passage. So anything bacteria or anything others dust or anything materials, so they give the signals to the body first time. Applied physiology. What is the applied physiology of adenoids? Responsible for development body immunity and antibody function, particularly early in life. Because somebody said up to 2 years and somebody said up to 3 years. The protection to the lower respiratory tract by guarding the entry of their places, already said. Formation of lymphocyte and plasma cell. Formation of lymphocyte and plasma cell. Germinal center of the follicles produce secretory antibody of hemoglobin A class. Whereas T lymphocyte in parafollicular region produce cell-mediated immunity against various pathogens. And various pathogens which enter into this lymphoid tissue are dealing by hemoglobin and hemoglobin G, antibody secreted by plasma cell. So for lymphocyte and plasma cell, so there is a difference for hemoglobin A class. Germinals are follicular body secret. Just you know that that is a formation of lymphocyte and plasma cells. It is a complete answer, but there is a description, so description is not needed. Just some teachers, you asked question, what are the antibodies class produce? Hemoglobin A, hemoglobin M, G. That's enough. And there is a 4 acts as a watchdog. Watchdog by continuous monitor the different varieties of bacteria in incoming year and fork and on the body accordingly. I already said it before. That is, that is it's the beginning of the food and air process. So it is a watchdog. Watchdog means this is our কুকুর আমাদের ম্যাক্সিমাম বাড়িতে দেখা যাচ্ছে যে কুকুর আছে যারা রাত্রেবেলা পাহারা দেয় বা তারা ছেড়ে দেয়, সেজন্য ওরা কি করে যাতে চোর ডাকাত ঢুকতে না পারে, ঠিক সেভাবেই ব্যাকটেরিয়া এবং ভাইরাস যাতে ঢুকতে না পারে এই adenoids and Waldear's ring তারা watchdog হিসেবে কাজ করে। So what is the another question? Waldear's lymphatic rings. What is the inner ring? What is the outer ring? Another question arises from the teachers. You should know it. You should know it, and everybody is know it. There is a Waldear's ring is the inner ring, and there is the outer ring is the cervical lymph node. Cervical lymph node. There is a 7 level. So I should know. It's a head neck region. They will tell you, but we should know about the important outer ring, that is rectopharyngeal nodes. Rectopharyngeal nodes. Jugular diastolic lymph node, jugular chain of lymph nodes, and submandibular nodes, submental nodes. Important is it's a rectopharyngeal lymph node. Jugular diastolic lymph node. What is this? It is the draining lymph nodes of palatine tonsil, partial tonsil or tonsil, jugular diastolic lymph node. It is half inch below and behind the angle of the mandible. And there is a jugular chain of nodes around the inferior jugular vein. There is a submandibular lymph nodes and submental lymph nodes. So you know about it. There is a inner ring and there is outer ring. Blood supply and lymphatics. Blood supply is important because surgery of the adenoids is very much crucial, because the patient is children and parents are so much, there is a intention or anxiety. And so surgeon is so much anxiety because there is a complication. If there is any surgery, there is a bleeding and hemorrhage occurs. So it's at the place of nasopharynx is a hiding place. It is not upper surface. So when bleeding occurs, it is so many complications occurred. So now receive blood supply, ascending palatine. This is not important, but we should know. Ascending palatine branch of facial artery, branches from the facial artery. Ascending pharyngeal branch of external carotid artery, pharyngeal branch of third part of maxillary artery, and ascending cervical branch of inferior thyroid artery. Most important, there is a external branches from the external carotid artery. There is a facial artery, maxillary artery, inferior thyroid artery. So we should, when go to surgery, before surgery, we should completely bloodless field. We stay the patient with bloodless field. And lymphatics for jugular diastolic lymph node, upper jugular lymph nodes directly or indirectly via rectopharyngeal and parapharyngeal lymph nodes. Yes, this is rectopharyngeal lymph node and biome and parapharyngeal lymph node. Because there is a nasopharyngeal carcinoma, patient is comes to you jugular lymph node, upper jugular lymph node, directly or indirectly by rectopharyngeal or parapharyngeal lymph nodes. So blood supply is, the tonsil is important, but adenoid is not important for the student. Okay, we go for next slide. Etiology. What is the causes? It is the physiological enlargement of the childhood. Physiological, it is the enlargement is physiological. Certain children have tendency to develop generalized lymphatic hyperplasia, in which adenoids is one of them. Some children have the genetical tendency, so lymphatic hyperplasia, so adenoids is one of them. Now come to the recurrent attack of rhinitis. Sinusitis and tonsillitis may cause chronic adenoid infection and hyperplasia. So a recurrent attack of rhinitis, that means nasal infection, sinusitis, paranasal sinus infection, and tonsillitis. All are causes of chronic adenoid infection and hyperplasia. So is the patient, some children, mothers, parents there is a frequent attack of colds, and with this tendency goes genetically to the children. So there is also, in my country, Bangladesh, there is so many seasons. There is a 6 season, and there is a change of, during the change of the season, climate, then there is some virus actively active and bacteria is active. So the children are, there is immunity is low. They are attack of rhinitis, sinusitis, or tonsillitis. Allergy of upper respiratory tract may also contribute to the enlargement of adenoids. Allergy is the most important factor. Allergy is cold allergy, dust allergy. It is common in our country. And the children always likes ice cream and other things. So the parents are so many polite to their children. They are being ice cream container or ice cream for their children when they come to the home. So it is when you see that it is important cause of adenoids. Clinical features. Clinical features are important. Signs and symptoms of adenoids depend on size of the adenoids, which comprises of nasopharyngeal airway. Compromise. There is a size grading system. There is a grading system. Go through it. And the adenoids block more than half of the airway, then it is produced more signs and symptoms, which include the nasal, oral, and generalist symptoms. It is the adenoids is placed nasopharynx, which is the root, which is the nasal airway, root of the nasal airway, and there is a close connection with the eustachian tube in the medial air cavity, oral, and generalized symptoms. So when the connected with nose, ear, so there is a symptoms of nasal and oral, and ultimately the children is when age is children, their parents is so much not anxious about their children because they about it adenoids, but they conscious about the surgery because the late surgery causes generalized symptoms. Late surgery causes generalized symptoms. Next slide, I describe it. Now, clinical grading of adenoid size, which as I said, there's grade 1, adenoid tissue filling 1/3 of the corner or nasopharynx, 1/3 adenoid tissue. Grade 2, 1/3 to 2/3 of corner, grade 2. And grade 3, 2/3 to nearly complete obstruction of the corner. And grade 4, complete corneal obstruction, complete nasal obstruction. So there is a 4 grade. There is a 4 grade. Grade 1, adenoid tissue filling 1/3 of the corner, then 1/3 to 2/3, and then 2/3 to nearly complete, grade 3. And there is a complete corner obstruction. There is also mild, moderate, and severe grading. There is a mild, moderate, and severe grading system. So normal, mild, mild is grade mild is grade 1, mild and moderate. Normal is grade 1, and mild is grade 2. Moderate is grade 3, and severe is grade 4. This is one picture of the child. This is open mouth. You see the open mouth. Nasal symptoms, most important. What is the happen after nasal obstruction? It is commonest symptoms leading to mouth breathing. It interferes with feeding and suckling, so child fail to thrive or underweight. What has happened? When the nasal blockage, the children cannot feeding or suckling. So what happened? The G2 arrow is blockage. So patient is when going to feeding after adequate, there is no adequate feeding. Patient যখন নাক বন্ধ, নাক দিয়ে শ্বাস নিতে পারছে না, তখন মুখ দিয়ে খাবার গেলে মুখও বন্ধ হয়ে যাবে। তাহলে কি হবে? দু সাইড কোনো এয়ারওয়ে তার ক্লিয়ার থাকছে না। সেজন্য দেখা যাচ্ছে যে চিলড্রেন পেশেন্ট তারা ফিডিংটা একদম লো ফিডিং, খেতে গেলেই বা সে খাওয়া থেকে দূরে থাকতেছে, কারণ তার কষ্ট হচ্ছে খাইতে, কারণ তার নাক বন্ধ আর মুখও বন্ধ হয়ে যাচ্ছে। সুতরাং তার ওয়েট গেইন হচ্ছে না, তার অপটিমাম যে গ্রোথ দরকার এটা হচ্ছে না। In infants, there is a noisy breathing and eating, drooling, snoring, and toneless voice. Noisy breathing, I show you video, and breathing and eating. Drooling means there is a angle of the mouth, there is a saliva secretion, drooling, and snoring, there is a noisy respiration, and toneless voice, nasal voice, there is a nasal voice. Some কিছু শব্দ আছে যেগুলি আমাদের nasal voice, nasal clearance দরকার, নোজ থেকে আসে, সেগুলি তারা বলতে পারতেছে না। আমাদের যেমন নাক বন্ধ করে কথা বলি, আমি যেমন আমি নাক বন্ধ করলে এখন দেখতে পাচ্ছ আমার কথাগুলি কেরকম আসতেছে, জাস্ট এইভাবে কথা বলে। সুতরাং নাক ক্লিয়ার থাকতে হবে, সেজন্য nasal discharge. It is also associated with rhinosinusitis. I told you that rhinitis and sinusitis and corneal obstruction, nasal discharge, because secretion of nose is not clear through the nasopharynx and going to the pharynx, and it is absorbed or swallowing, or everybody can সবাই যখন সালাইভা যখন আসে বা যখন সেক্রেশন তৈরি হয়, এগুলি পিছন দিকে যাবে, যে গেলে এগুলি মুখ দিয়ে বেরিয়ে যাবে অথবা অনেক সময় স্টমাকে চলে যাবে। সুতরাং যখন নাক ন্যাচারাল ডিসচার্জ গুলি হচ্ছে, there is a সামনে দিয়ে আসতেছে, the frequent attack of cold there is a the normal nasal secretion cannot drain into nasopharynx. This is important. The child nose is full of secretion like what? Bubbles nose. তার দেখা যাবে যে পেশেন্টের প্যারেন্টস এসে বলতেছে যে তার নাক সবসময় ভিজা থাকে, So this is all right, nasal symptoms. Oh, yes, another picture. There is a prominent incision teeth. You see an open mouth. There is a no nasolabial part or group. The pinched nostril. Okay, I go. What is the happen? Nasal syndrome. Oh yes, there is rhinosinusitis. In childhood, the adenoid is implicated in chronic rhinosinusitis, acting as a pathogenic bacteria. It is due to persistent nasal discharge and infection. Primary maxillary sinus may also lead to adenoids. Epistaxis, most important. When adenoid is infected, it will occur due to nose blowing. Nose blowing means naak jore blow kora, erom kore shabdo kora naak diye, যেহেতু সে নাক দিয়ে শব্দ নিতে পারতেছে না। Voice change. Voice is toneless and less nasal quality. Nasal quality losses in nasal quality. Oral symptoms. It is also most important. Hearing loss. Adenoids block distal tube leading to retracted tympanic membrane and produce conductive hernias. Retracted tympanic membrane is the other cause of chronic otitis media, etiquental type, etiquental with cholecytoma. Retracted tympanic membrane always produce cholecytoma. And then otitis media diffusion, blue air, serous otitis media. Already I said, due to blockage of distal tube, medial layer secretion cannot drain, fluid retention in the medial layer, and causes otitis media diffusion. Recurrent acute otitis media due to spread of infection in eustachian tube. Chronic suppurative otitis media, chronic otitis media may fail to resolve due to presence of infected adenoids. Previous class, one student asked me that there is a one of his relative said that there is a pain, recurrent character of acute. Acute otitis media means there is acute otitis media always means the acute inflammation. So there is a pain, always pain. There is a 5 symptoms. So there, when the X-ray occurs, and is there is a occurs chronic otitis media, that may fail to resolve due to presence of infected adenoids. So oral symptom is important. Hearing loss, adenoid diffusion, recurrent attack of acute media, chronic suppurative otitis media may fail to resolve. This is 4 things. Generalized symptoms. It is I showed that there is a when adenoids is compromised the nasal airway or natural airway, then there is a producing adenoid feces. Chronic nasal obstruction and mouth breathing leads to facial appearance, all the adenoid feces. So it is there is so many questions. It is every year there's a question. What is the adenoid feces? How it comprises? Open mouth, elongated face with dull expression. Why dull expression? Because patient do not hear. Patient does not hear. Patients do not hear. So there is no expression of face. Patient যদি শুনে কেউ যদি হাসির কথা শুনে সে হাসবে, কান্নার কথা শুনে সে কাঁদবে, বা রাগান্বিত হলে সে রাগান্বিত হবে। এই যে ফেশিয়াল এক্সপ্রেশন, এটা আগে শুনতে হবে, তারপর সে ফেশিয়াল এক্সপ্রেশনটা ডেভেলপ হবে। সো একটা বাচ্চা ছেলে যখন কার্টুন দেখে তখন সে কার্টুনের ইয়ে দেখে হাসে, বা ইয়ে দেখে বা অন্যান্য খারাপ জিনিস দেখলে ভয় পায়, ভয়ের এক্সপ্রেশন দেখায়। সুতরাং এই এক্সপ্রেশন গুলি তার হবে কখন? যখন সে শুনবে। Prominent incision teeth. You see one picture, there is a prominent incision teeth. Overcrowding of the teeth. Overcrowding. There is a so many children patient comes with us. There is a 2 or 3 teeth above one another. Overcrowding. High arch palate. High arch palate. Palate is there is a molding action. Molding action. There is effective, natural effective of the patient. When the natural airway is present, there is a molding effect on palate. But when there is mouth breathing, there is a the loss of the molding action. So higher palate occur. Pinched nostril, pinched nostril. This is atrophy of ala of nostril and loss of the nasolabial furrow or fold. This is atrophy. Ala of the nostril. There is a pinched nostril, pinch. This is one of the other. This is one of the type pinched nostril. The nostril is pinched because this is not used. This is nostril and open mouth, incision teeth prominent. There is another picture. You see that open mouth, mouth breathing. There is a pinched nostril, pinched. Yes, it's one of the picture of nasopharynx lateral view. There is a picture of nasopharynx lateral view. You see that this is the nasopharynx. This is the nasopharynx. There is a almost full the nasopharynx with adenoid. With adenoid. You see that there is the airway, some airway, but not nasal airway is absent. This airway is coming from the mouth. This is anteriorly airway, and posteriorly there is a esophagus or esophagus. So generalized symptoms: pulmonary hypertension. This is double long-string nasal obstruction leading to pulmonary hypertension and called pulmonary. J2 pulmonary hypertension, there may be lack of development, thorax and flat, with flat chest and round shoulder. Chest is not developed and round shoulders. General disturbance, the open mouth leads to spongy gum and excessive thrust. Spongy, there is gum is spongy. There is some children with come with the teeth is, there is a fork teeth. There is only fork teeth and some teeth is no teeth. Excessive thrust. Mental dullness and apathy may be marked and are due to poor breathing, bad posture or deafness. Posture means that there is a lying down in phonation. Phonation lying down. You see that lying down for bad posture and deafness. And poor breathing. Nocturnal enuresis. Habit tics and night terrors may occasionally be aggravated by adenoids. Patient attendant told you that the Rugira Bisnai, Bachara Bisnai, Postra Kordek. One, habit tics, that Kirmir Kora, and night terrors. Jate Gume Kirmir Kora এবং যেটা ইয়ে করে যে ঘুমের মধ্যে লাফ দিয়ে উঠে পড়ে। পেশেন্ট স্লিপ অ্যাপনিয়া হয়, শ্বাস নিতে পারে না, হঠাৎ লাফ দিয়ে ওঠে এবং তারা কি করে দুঃস্বপ্ন দেখে, সবসময় দুঃস্বপ্ন দাঁত কিরমির করে। এই শব্দগুলি বলবে পেশেন্ট অ্যাটেন্ডেন্ট এসে, aggravated by adenoids. So there is a nasal symptoms, oral symptoms, generalist symptoms, and there is a adenoid cases, most important. There is a questions, so many questions. There is another video. You see that this is another video of one adenoid children. So you see it, how he can I think you hear. You see that full picture is enough to understand the adenoid, mouth breathing and snoring. There is a difficulties in respiration. How this is the important for pulmonary hypertension, to develop pulmonary hypertension. How can sleep? Because the patient is sleep apnea. To take the video, the parents is supination. Take him supination position. Take the video. One of my patients come to me with this video that how, what happened. We go so many doctors. So it is you see that the video is the one is the video is important for you to understand the adenoids. Patients first time goes to the pediatrician because there is a respiratory distress and other things. And patient is children, so go to pediatrician, and they are giving drugs. Sometimes some symptoms is reduced, but not fully. When they've referred or come to the, when they understand that nasal breathing is not completely done by the patient, then the patient come to the otolaryngologist. What happened? So then one X-ray is important, nasopharyngeal X-ray, diagnosis, history, examination, investigation, confirm the diagnosis. Only one investigation is enough to diagnose the adenoids. X-ray, nasopharynx, lateral view, reveal the size of the adenoids and also the extent to which nasopharyngeal air space is compromised. Yes, when one patient come to you, you only one X-ray, nasopharynx, lateral view, X-ray is diagnosis is completed. So you never miss this. When one children patient, you go to the when you doctor, then go to the village or any place. When one patient come to you, children patient, and there is a mouth breathing, nasal obstruction, we go for one X-ray, X-ray nasopharynx lateral view, and we asked you in the Viva question that only one thing you say, that you confirm the diagnosis of adenoids. So you must say external nasopharynx lateral view reveals the size of the adenoids. So other pivot investigation is a common investigation for anesthesia and patient blood for TCBC is 7%. You say in the examination blood for total count, differential count, exercise sedimentation rate, and hemoglobin percentage. Bleeding time, clotting time, serum SBS is not important. Urine, routine macroscopic examination, X-ray, chest view. It is most important. That is another important thing. So blood grouping. Blood grouping is most important to do because when developing a complication of hemorrhage after surgery, it is important to know about the blood grouping. So I miss it. Specific investigation for sickle cell disease, thalassemia, Down syndrome, and congenital heart disease as appropriate. Sickle cell disease, thalassemia, Down syndrome, and congenital heart disease, they all are comes with the adenoids. So we refer to special center treatment. Traditionally, surgery and vascular wetting are the only option for symptomatic adenoid disease. Topical nasal steroid will probably find a rule in clinical practice, but there is no rule is unclear. Adenotomy or adenotonsillectomy is indicated under symptoms of birth. In secretory otitis media or blue ware, mangotomy and section of the thick secretion with or without insertion of grommet will be done with adenotomy. It is most important. One patient will come you to test done hearing test. Hearing test also done. If hearing test there is OME, occurrence OME, then you go for mangotomy. And after mangotomy, we give a one instrument, grommet. Grommet for there is a ventilation tube. It is a ventilation tube, like your room. There is a window. It's ventilation. So if middle air not ventilated, so eustachian tube. So it is most important for hearing. The conductive deafness occur. So I think this is enough treatment. Is enough. The surgery is the only treatment, to say, always. Because medical treatment, there is no medical treatment. When symptoms produce, only mild case, you can treat the patient medically. So this is the end of the adenoids. I think everything is you understand. So I think you can some question about it, adenoids. So I think, my dear student, you hear me? Hello? 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 My dear student?
Yes, sir.
Okay. Have you any question? Have you any question? Please ask me. Hello?
College কবে খুলবে স্যার?
College 13 তারিখে খুলবে, 13 তারিখ।
স্যার আমরা তো এখন নোটিশ পাইনি স্যার কোন, স্যার সেজন্য বলছিলাম।
না না, নোটিশ তো আসলে তোমরা দেখো না, যে তোমাদের টিভি দেখতে হবে তো, টিভি না দেখলে কেমন হবে? টিভি এসব আমরা আমাদের যে মাস কমিউনিকেশন যেগুলি আছে এগুলিতে খবর নিতে হবে। তোমরা করো যে তোমরা কলেজে ফোন করো, ফোন করলে তোমাদেরকে তো জানাবে। তোমাদের কাছে ফোন নাম্বার আছে না কলেজের? 13 তারিখে সরকার ঘোষণা দিচ্ছে, হ্যাঁ খুলে দিবে। সুতরাং তোমরা এটা হোস্টেল কখন খুলবে? হোস্টেল তো 1-2 দিন আগে খুলবে, সেজন্য তোমরা ফোন করো, কারণ হোস্টেলের ব্যাপারে তো আমি অ্যাসাইন্ড। সো হোস্টেল যে আছে তোমাদের হোস্টেল সুপার, ওনার ফোন নাম্বার আছে তোমার কাছে, তোমাদের কাছে? হ্যালো? হ্যালো?
জি স্যার।
তোমাদের কাছে ফোন নাম্বার আছে না?
জি স্যার।
হ্যাঁ, তোমরা ফোন করে কনফার্ম হও, কনফার্ম হও। তোমাদের তো প্লাস তোমাদের সবার টিকা দেওয়া হয়ে গেছে অলরেডি? টিকা দেওয়া হয়েছে না সবাই?
ইয়েস স্যার।
তো নো প্রবলেম, নো প্রবলেম। তাহলে তোমরা এখানে ফোন করো, তোমাদের কাছে যে ফোন নাম্বার আছে